everyone, and welcome to the Academy of Rational Emotive Behavior Therapy YouTube channel. Today, we'll be talking about the training manual that Dr. Wendy Dryden wrote, which will form the primary text of the year-long training program we're offering for mental health professionals. So tell me, Wendy, tell me a little bit about this fine book. It's now in its third edition. And when I was reading it on vacation, I was saying to myself, wow, this is quite a lengthy piece of work, really in-depth dive into how to skill somebody who's serious about wanting to do rational emotive behavior therapy. Tell me a little bit about this book.
It is in its third edition. I wrote it to be the core text for my master's program in rational emotive behavior therapy that I ran at Goldsmiths, University of London many years ago. And I used it as an intensive skills-based training for the students. And, I felt it was so successful, I retained it. I did a second edition, and then after the course ended, I decided that I would still want to keep it in press, and I updated it, and it's got a much larger in terms of size as I expanded it. It's a training manual that has stood the test of time, in that it has been in press for well over 25 to 30 years.
Well, let's take a little deeper dive into it. It looks like the first part of it talks a little bit about the theory of REBT, and then it goes on to issues in practice.
I thought that it was important to have a couple of chapters on what students needed to know about REBT theory and practice in order to get started, because it is a skills-based training manual, but it has to be informed by theory. Our rational emotive behavior therapy has got a particular theoretical stance that it is important to students to understand. But I didn't want to overburden students at this point with too much theory. So it was really an opportunity to get them up and running with what they needed to know about the theory and the practice of the therapeutic approach.
And what I really like is how it covers the teaching of the ABCs and the money model that helps students learn to communicate the discrimination between healthy attitudes and unhealthy attitudes. And chapter 3 goes nicely into the distinguishing between healthy and unhealthy negative emotions.
Yes, I mean, as I say, it is a skills-based approach, but it does match the particularities of REBT theory. We are one of the few approaches, the only approach that makes keen discriminations between what we call healthy and unhealthy negative emotions. And I wanted the book to reflect that and to start off students' understanding with that knowledge.
I think a great part of this book is the tables where you delineate the thematic content of the 8 basic emotions of rational emotive behavior therapy, as well as the action tendencies, behavior, and subsequent thinking. When I've taught at New York University, I've told students to study these tables because patients will flood novice clinician with data that we have to listen to and then sort out and put into different places in the ABC framework. And if you master these tables, which you've so granularly delineated, what you will do as a psychotherapist in training, begin to get a certain poise as people talk to you, and you'll be able to separate out the data and begin to identify the core data that you want to be focusing in on. I think that those tables are really, really a strong learning tool.
Yes, and I think that what it also does is clients give minimal information. You talked about situations where they flood the clinician, but when they give minimal information, you can use this schema in terms of that particular table to drive the questions to get the information that you need as a rational emotive behavior therapist. to help the person. And so it is a way of making sense when you get a lot of information, but it's also a schema that you can use it if you get too little information from the client, so it can organize and drive your questioning.
That's a great point. Then you go into assessing the C in the ABC framework, assessing A, and then finally assessing B in separate modules or separate chapters. And this is the firing order by which we begin to work with a patient.
Yes, it's often helpful to think about the idea that you're catching a cab, right? You start with C, you go to A, and then you go to B. So catch a cab if you're wondering as a new REBT therapist what you're supposed to do in terms of assessment. My advice is to catch a cab.
No.
And there are situations that new therapists have to deal with. For example, clients will often talk about their feelings as inferences. So they say, I felt criticized or I felt rejected. And of course, these are not emotions. In the book, I speak about how to deal with situations when clients give you what they think are feelings, but are really not.
Right. That's really important discrimination that novice REBT therapists have to make. Discrimination between an inference and a feeling.
Yeah.
Um, right. And then you go on to assessing meta-emotional problems and goal setting. The assessing meta-emotional problems was really a unique feature of REBT.
Yes, I think Albert Ellis, did a lot to point our way to understanding that CBT therapists call this distress intolerance. Whereas I think the idea is that with the meta problems that people can disturb themselves about their emotions, they can disturb themselves about their behavior, and they can also disturb themselves about their thinking. I think that needs to be a broad categorization. And I think that's reflected in what I've written about in the book.
And then, of course, goal setting is an important chapter. I was working with a patient earlier this morning, and I work in a medical school. And of course, the framework for the note taking is more of the medical model. And I found myself writing the note from the standpoint of working with this particular anxious woman was to help her have a healthy emotional response to her performance. And so I had to translate the goal into REBT language so that I could begin to conceptualize a patient from an REBT perspective. This is something I think that most people don't think of. When we think of goal setting, we think in terms of, treating a disorder or a symptom, but we're very specific in our goal setting.
We are, and I make a distinction, which is reflected in the book, between goal setting before you've assessed the client's problem and goal setting afterwards. Because if you ask the client at the beginning of therapy what they want to achieve from seeing you, they will say things like, I don't want to be anxious, or I want to be less anxious. And rather than engage them in a discussion at that point, it's useful to recognize that once you have assessed the problem, then it helps the client to become clearer because you're utilizing both an assessment of the problem, but also an assessment about what they want to talk about, what they want to achieve as a result of talking about the problem. So it's clearer, for example, that instead of being anxious about a particular threat, if that threat occurs, it's healthy to be concerned but not anxious about that threat. That's a discussion that is much easier to have with a client after you've assessed the problem rather than before. But it's still useful to get an understanding about, right from the get go in terms of what clients want to achieve by actually talking about their issues with you.
Now, I think one of the changes you've made in the language of REBT should be noted in that we're using attitudes with great consistency rather than beliefs. And you and I prefer the idea of examining our attitudes rather than disputing them, although sometimes I'll use disputing, but I'll
Yeah.
define what I mean by that. But I think examining really conveys what we're doing with the patient. or the client. Why don't you talk a little bit about why you elected to use the words examine in this book and attitudes instead of the more traditional terms of disputing for and irrational beliefs?
Well, one of the things that Albert Ellis used to encourage clients and also therapists to do is to think for themselves. And it occurred to me, and I think I wrote about it first in 10 years ago in a book published in 2016, that I was always uncomfortable about the term belief and certainly uncomfortable about the term dispute. The term belief, I think, was used by Albert because it begins with the letter B. People often say things like, I believe in Jesus Christ, or I believe that the bus will be late. In other words, they're talking about different cognitive activities than we are talking about when we use the term belief in our theory. And it seemed to me, by looking at various definitions of both terms, that the term attitude was much more closely related to what we previously referred to as beliefs, because it represents the person's evaluative stance that they take towards, in this case, an adversity at A. So I liked the word attitude, and however, my problem at that time was that it began with an A, and I needed to kind of retain the ABC model rather than the AAC model. So I kind of came up with a number of different alternatives, but it was the noted scholar Dr. Walter Matweychuk who suggested to me, what about using the term basic? Because that stems with a B. And it also, reflects the idea that the attitudes are at the base or at the core, at the foundation of our clients' emotional responses to adversity. And so thank you very much, Walter. You've been very influential there. And when formally discussing the ABC model, I do refer to basic attitudes. But I think generally speaking, when I'm not dealing with the formalities of the framework, I do use the term attitudes.
Yeah, I use the term attitudes too, and I think it really conveys what we're talking about, the cognition that we're most interested in targeting in REBT. What about examination versus disputing?
Well, the term dispute, I mean, one of the things that certainly over the years has plagued REBT as an approach is the idea is that we argue with our clients. I mean, in a sense, the term argument has really got two meanings. One is to talk about different positions that you could hold towards the same event, or you can have the kind of argument that spouses might have that can get nasty. And yeah, I got rather fed up kind of defending REBT against that. And so rather than to keep doing that, I would say, well, like, okay, what is it that we're doing? We're actually encouraging clients to stand back and to examine both their rigid attitudes, if we just focus on that for a moment, and their flexible attitudes. So we're asking them to stand back and examine these two attitudes and to say, well, okay, which of these are true and which is false, which is logical, which is not, which is helpful and what is unhelpful to you. And what we're trying to do, and because again, I had the problem. Well, the word examination starts with the letter E. So I wanted to have something that began with the letter D. And so the term dialectical is an attempt to resolve a situation where there are two positions that are, and that is really what occurs in REBT. Again, if we take the rigid and flexible attitudes. The flexible attitudes is saying something like, I want you to like me, but you don't have to. And the rigid attitude is saying, I want you to like me, and therefore you do have to. And and so the term dialectical examination is trying to, if you like, encourage the client to say, look, you know, these are diametrically opposed. Which do you want to take forward?
Which will yield better results.
Which will yield better results, which is more sensible, and which kind of reflects the reality of the situation. Is there a law of the universe that says that because you want to be liked, you have to be liked? Does the world just say, oh, wait a minute, Windy Dryden wants to be liked, we have to give it to him? So I thought the term, sort of dialectical, with it started off, of course, with dialectical behavior therapy. But I think the term dialectical serves our purposes. Now, again, when I'm formally talking about the ABCD framework, then I will use the term dialectical examination because it begins with a D. But when I'm not formally discussing that particular framework, then I'm quite happy to use the term examining.
And of course, we move on to the issue of how to strengthen conviction in healthy attitudes and homework assignments, which are often one of the best ways to strengthen conviction. And so in this book, you talk about negotiating homework assignments and strengthening conviction because one can parrot a healthy attitude, but we want one to really actually believe it.
Yeah. And I think that, going from, the beginning of the process to where we are now in talking about the issues now, that really gives students a thorough foundation to the skills that they need to actually go forward into clinical practice. And then when they go into clinical practice, it's important they get supervised in their work. And one of the strengths in my mind, of rational emotive behavior therapy training is that the stress that it is placed on listening to digital voice recorders, because it shows you to what extent the student is actually implementing the skills that they're learning in the talk part of the program. So we
But but the point being is that teaching students to create homework assignments that are actionable by the client, challenging but not overwhelming, and it's really an art to be able to come up with a good homework assignment.
Yeah, to actually implementing the assignment, dealing with their doubts, reservations, and objections to that, and also about dealing with their doubts, reservations, and objections about any aspect of REBT.
Which is how you
Because
close the book, which is
yeah,
great, which
yeah,
is really great. And then, of course, you have some appendix homework skills monitoring form and possible reasons why somebody didn't complete their homework. So it's really a very thorough book for anybody who's serious about learning to be an effective psychotherapist. REBT therapists, one of the strengths of REBT is that it was not developed in academia. It's a real world therapy that developed with people who had multiple diagnoses. As I like to say, developed with people from the rough and tumble streets of Manhattan who came in with multiple problems, and Ellis rolled up his sleeves and worked with them. And I think that if you're serious about learning how to help people, then the training program Wendy, you and I are offering people is an extremely good investment that will help them go a long way towards learning how to help people and how to help people learn to help themselves. REBT really empowers both the therapist and the client. And I think this program and this training program in this book is going to go a long way towards helping people do that. I'm speaking to the viewer. If you're serious about becoming capable as a psychotherapist, then this training program is for you. Wendy, do you have any concluding comments?
no, just like to echo your concluding comments, Walter. I think I'm excited about the development, the establishment and development of our new Academy of Emotive Behavior Therapy. I'm excited about launching a training program where we take students through from beginning to an end. We don't chop and change. It's really a cohort of students working together and developing sort of trust in one another. And I think like you, it's a good use of your funds if you are thinking about training as an REBT therapist.
If you need more information, Academy of REBT, the letters.org, and you can see the syllabus and the modules that we're going to be doing and get all the details for this. Wendy, thanks for your time. And obviously, thank you so much for your fine contribution to the REBT literature. You've written more on REBT than anybody I know, including probably Albert himself. And
Well,
so
I counted up the other day. I've written or edited 118 books on REBT.
well, that's great to hear. And I don't have the time to read all of them, but I've read many of them. I've certainly learned a great deal by reading them. So I think any serious scholar psychotherapies of cognitive behavior therapy in general. And then if you really want to take your game to a new level, you'll learn the REBT. This is the training program for you. Thank you, Wendell, for your time. And I look forward to talking to you some more on this channel.
Thank you.